Good morning. Today we're going to talk about pressure ulcers and how to change sterile dressings. The cause of pressure ulcers. It's a localized damage of skin or an underlying soft tissue, usually over a bony prominence or related to a medical or other device. Pressure injuries, major risk factors are immobility, inactivity, moisture, malnutrition, advanced aging, alternative sensory perception, lower mental awareness, friction, and snares. Contributing factors are dehydration, obesity, and edema. How they are staged. Stage 1, pressure injury. An area of intact skin that is red, deep pink, or molded skin that does not blanch when fingertip pressed. In people with darker skin, there may be discoloration of a surrounding skin, warmth, edema, and induration in comparison to surrounding tissue may be signs of a stage 1 pressure injury. Stage 2, partial thickness skin loss with exposed dermis. The wound bed is pink or red and moist and may appear as an intact or ruptured blister. Stage 3, full thickness skin loss that looks like a deep crater and may extend to the fascia. Subcutaneous tissue is damaged or neurotic. Fat is visible, undermining the tunnel may be present. They may be damaged to surrounding tissue. Stage 4, full thickness skin, loss of intensive tissue, necrosis, or damage to muscle, bone, and surrounding structures. Sinus tracts may be present. Infection is usually widespread. The injury may appear dry and black with buildup of tough neurotic tissue, eschar, or it can appear wet or oozing. Unstaging pressure injuries, loss of full thickness of tissue. The base of the injury is covered by eschar in the wound bed, or the base of the injury contains slough. Deep pressure injury, localized discoloration, intact skin that is maroon or purple, or a blood-filled blister resulting from damage of underlying soft tissue from pressure and snaring.
Today we're going to talk about how it heals. Healing process. Wounds are open and closed and clean or dirty. Wounds may be partial thickness, superficial, and healed by epithelialization, or full thickness and healed by contraction. Two primary methods to healing are replacement of cells and regeneration. Phases of wound healing. Inflammatory phase begins immediately after injuries and lasts approximately 3 to 4 days. Proliferation or reconstruction phase begins on 3rd or 4th day of the injury and lasts 2 to 3 weeks. Maturation or remodeling phase begins approximately 3 weeks after injuries. First intention, wound with little tissue lost, side chance for infection because of the edges of the wound approximately close together. Second intention, wound with tissue loss such as pressure injuries or severe laceration. The edges of the wounds don't approximate and the wound is left open and fills with scar tissue because of the longer healing period. Infection is higher. Third intention, known as delay or secondary closure occurs when stuttering of the wound is delayed. Sutures after granulation tissue has begun to form. Surgically, wound heals by the first intention because they have little tissue loss as at the surface. Wounds with tissue loss healed by the secondary intention.
Now we're going to talk about how to perform a sterile dressing. Sterile procedures. Sterilization is the best method of eliminating microorganisms from equipment and supplies. There are 5 methods in sterilization: steam under pressure, dry heat, ethylene oxide, liquid chemicals, and hydrogen peroxide gas, plasma. Moist heat is most often used by applying steam under pressure in a device called an autoclave. Steam sterilization has 4 parameters: steam, pressure, temperature, and time. Since it is also being applied under pressure, temperatures are higher than the boiling point. Under pressure, steam reaches temperatures of 250 degrees Fahrenheit to 270 degrees Fahrenheit. Ethylene oxide gas is effective against microorganisms and spores. For clean items in a whole, boiling the water is the easiest method. Items should be boiled for a minimum of 15 minutes. Items that cannot be boiled or disinfected by running them through a dishwasher sanitizing cycle can be exposed to direct sunlight for several hours. The heat and ultraviolet rays kill many exposed microorganisms. Ultralight can be used to sterilize drugs, food, and other items that will be damaged by heat.